While I still have you, so we've talked about sort of intra and intersexual relationships among primates. We've likened that to humans as well, but from my understanding, you're also involved in some of that human research, the intra and intersexual dynamic that takes place in the workplace. Is that where your research lies?
Yeah. So at the Emory Hospital, which we can see from here.
Yeah.
I had a postdoc, Laura Jones, who would go into operating rooms and sit in a little corner with a pad, an iPad, and type in data the way we do for primates also. She was not allowed to video record the people, so it was all codified behavior. And we did that because an anesthesiologist in the hospital, he had told me he had read my book Chimpanzee Politics, and he said the operating room is like chimpanzee politics. He felt there was so much parallel between the power struggles that were going on between the anesthesiologist and the surgeon, or the surgeon and the head nurse, and he mentioned all these crises that occur and what happens in these operating rooms. And so we wanted to document that. And usually in an operating room, the alpha individual is the surgeon. And so
makes sense.
And they can be both genders nowadays. I think it's almost 50-50. Like it can be male.
In surgery?
Yeah.
I correct me if I'm wrong, but I thought my understanding was that in medicine broadly, it probably leans towards females, but specifically in surgery, I thought it was a male-dominated subspecialty, like among surgeons.
Yeah.
Like as an occupation, that was just my understanding.
No, I have to look up my study, but I think there was a lot of women there. So
in the one, okay, right, in the one you published, yeah.
Yeah, the one that we published, there were a lot of women, not more than men, but there were a lot of women surgeons. And actually, one of the interesting things of that study that came out is that we could not tell from the behavior a gender difference between the surgeons. So the surgeon, whether it's a man or a woman, they behave exactly the same. The sort of data that we take is like who criticizes whom, who laughs with whom, who compliments whom, who asks for assistance, and how do you do it. So we had a lot of categories of behavior.
Right.
And the male surgeons and the female surgeons acted exactly the same.
So if I were to read those markers of behavior, I wouldn't be able to discriminate.
No.
Between male
and
female.
We did not expect that, but that's what we found.
Right.
So they're both acting like the top dog, clearly. And then we also found that all female teams, they are not so common, they do very well. That mixed teams do very well. All male teams are a bit boisterous, and so that happens sometimes that you have an all male team. There's a lot of rough behavior among them going on,
right,
that they probably tone down when there are women in the room. And so I think the most interesting finding that we had was that because we were looking for conflict, when does conflict occur in the operating room? That if you have a male surgeon with a mostly female team, there's a high level of cooperation. If you have a female surgeon with a mostly male team, there's a high level of cooperation. The conflict occurs mostly when you have a male surgeon with a lot of men in the room, or a female surgeon with a lot of women in the room. And the explanation that I have for that as a primatologist is
right,
that for the alpha male, it's important what his status is among men. And for the alpha female, it's important what her status is among women. And that's why you get sometimes conflicts with the same gender people.
That is so interesting. So when you say these conflicts arise when there's more of a representation of one gender over the other, let's say, when you're saying they do well or they do poorly, do you mean like the harmony among the group, or do you mean like a clinical outcome?
No, the harmony among the group.
Okay.
We did not measure the clinical outcomes, so we measured the level of behavior, and surprisingly, the behavior in the operating room is extremely variable. People don't always realize that there's gossiping and laughing and dancing, and there's usually music going
right,
on, and so it's a it's a microcosmos of society that's going on, and the patients, fortunately, they don't always know what's going on.
Fair.
But
It'd be concerning if they did.
Yeah, when people need to be for 10 hours in an operating room, of course they're not always paying attention necessarily to the task at hand. They also have other things that they talk about.
Right.
Yeah.
And I just want to specify, like, I know the answer to this, but you're not one for the conventional psychological measures of survey data and all this stuff. So what you're purporting here is based strictly on behavior. It's not like you went and asked the team, well, how do you feel the surgeon thought about you today?
That's the problem, is that if you ask people, let's say there is a conflict in the operating room, and you ask people, it's of course never their problem. It's somebody else's.
There you go.
Yeah, and that's why you cannot trust these data. So we wanted to do observational data, so study the operating room like a monkey group, basically. And I found this tension between the alpha individual and same gender co-workers. I found that interesting. That came out of that study. Yeah.
So between, let's say, the male alpha team member and then his partially female team, and then female alpha with mixed gender team, do either of them perform preferentially better, or is that like almost equivocal to each other?
You mean if the surgeon does better?
I meant like the team. Like, do they lead in different ways? Is the harmony different?
Yeah. There's a higher level of cooperation. So we had a sort of index of how much cooperation, how much conflict is there in the room.
Right.
And so the conflict goes down if you have an alpha with mostly members of the opposite gender. Yeah.
But does it matter which? My question is, does it matter which gender the alpha is, as long as the team members are opposite?
I think it was stronger for men, but male surgeons.
Okay.
But I'm not sure that there was a big difference there. Yeah.
Okay, so from that, what I can extrapolate is that within the workplace, a conflict mitigation tool, let's say, is to have intersex teams. I guess across the board, it doesn't even matter necessarily who's the top dog, if you will.
Yeah. But I had the article, one of the reviewers was an anthropologist.
Okay.
And she works with people in New Guinea. She usually works with people, non-Western people. And she said to me that that's only possible that these mixed gender teams do so well if you have rules for male behavior. So what she meant is that if the men are obnoxious or aggressive or sexually abusive, then that whole cooperation is going to fall apart.
Oh, I see.
And she said this only works if you have cultural rules like we have in our society nowadays.
Right.
That men have to behave in certain ways. So she because she was comparing it, of course, with the people that she knows, and she doesn't think it would work the same way there.
Oh, I see what you mean. It would be interesting to sort of repeat that type of observational study in a different environment, because I imagine people working in an operating room are highly educated, highly civilized. They probably had access to the most resources throughout their entire life. They have a certain decorum to them, right?
Yeah.
And a social understanding. So perhaps there's merit to her argument.
About cultural differences. A funny thing happened is that the study was reviewed in some sort of German magazine, and I read German, and so this was a German professor who was claiming we never have conflicts in the operating room. We in Germany, we never have conflicts in the operating room. And I know that these conflicts occur everywhere. In Japan, in Holland, everywhere I go, I hear that there are sometimes conflicts in the operating room.
Right.
But this German, he thought they were non-existent, which would be very surprising.
Oh, he just dismissed the phenomenon altogether?
He was totally in denial, I think, about it. Or maybe he was a surgeon himself and didn't see the conflicts, because they don't always see what they do.
Fair enough. No, I think that's amazing that we can draw that insight from that work environment.
In the Netherlands, I know for sure that some clinics had been closed for a couple of weeks because there was too much conflict going on.
Oh, it gets that.
Yeah, and
that
I
bad,
bet that happens in Canada also sometimes. Even though the Canadese are so polite and friendly.
No, you don't want it to push us the wrong way. We bite back, but fair enough. yeah, in such a stressful environment, you still see that the intersexual dynamic come out and reduce conflict, which is probably a surprising outcome for most people to hear.
Yeah.
That's fascinating. Are you doing anything else like that, or?
No, this was a one-time
Just a
human
one-time?
study that we did.
Oh, okay. Well, I hope your colleagues continue that type of work. Very, very interesting.
Okay.
All right, we'll call it there.